I want to cover an aspect of healthcare that is actually really continuing to grow as time really seems to progress. So in this episode, there's a couple of things I want to get into and really discuss. For instance, what is precision medicine? What's happening with it? What impact can this have on racial disparities in healthcare? And what can this ultimately look like in the future? So the thing about traditional medicine is that it's often looking to really treat a large majority. With precision medicine, it's really having a much stronger focus on what's going to help a specific physician's patient. Hey, my name is Charpentier, and welcome to Less Than 3%. We talk about healthcare, my journey becoming a physician, and really anything from the perspective of a black male pursuing medicine. And in this episode, I want to get into a topic that I think is very, very important and really connects to probably some of the topics we really talked about on this podcast previously. I want to cover an aspect of healthcare that is actually really continuing to grow as time really seems to progress. And this is something known as precision medicine. So in this episode, there's a couple of things I want to get into and really discuss. For instance, what is precision medicine? What's happening with it? What impact can this have on racial disparities in healthcare? And what can this ultimately look like in the future? So the first thing to really do when discussing this topic of precision medicine, I would say, is ultimately to define it. So for that, I want to look at an article really quick on cancer.gov. And they give a solid definition of what precision medicine is. They mention that it's a form of medicine that uses information about a person's own genes or proteins to prevent, diagnose, or treat disease. And so precision medicine really uses specific information about a person's tumor, in this case, in the context of cancer, but really in a variety of health conditions, to help make a diagnosis, plan treatment, find out how well a treatment is working, or make a prognosis. I would say the significant thing about precision medicine is the fact that it's very, very focused on personalizing patient care, especially considering the growth of technology, which can really play a role in this, as I want to get into. Precision medicine really just allows for focus on specific patients and just a lot of the nuances that can come into play when it comes to different patients, because not every patient is the same. Not every patient might have the same family history or social determinants. Not every patient may have the same health conditions or be on the same medications. And so precision medicine is really one of those things that helps to really highlight the different nuances that can come into play when it comes to caring for specific patients. So with all that being said, I really want to talk about what exactly makes precision medicine special. What's the difference between precision medicine in specific versus a lot of the patient care that already gets done? And I want to really highlight specifically what the traditional model is compared to what precision medicine brings into healthcare. So for this, I want to look at an article written by Stephanie Watson, which is on WebMD's website. And this talks about traditional versus precision medicine, how they differ. So one thing they highlight that I want to point our attention to is the fact that, quote, in Western medicine, scientists develop drugs to treat the symptoms or the disease itself. They test the drugs in clinical trials that involve large groups of people that have that disease. And so the FDA will approve a new drug when studies show that they are more likely to benefit rather than being harmed by the prescribed medicine. Yet, that doesn't mean that the medicine will help everyone who takes it. That's where precision medicine comes into play. So the thing about traditional medicine is that it's often looking to really treat a large majority. So it's really looking at what medications seem to be the most effective for the greatest amount of people. And that's what's ultimately looking to be prescribed. But with precision medicine, it's really having a much stronger focus on what's going to help a specific physician's patient. And so it's definitely a lot more personal compared to just the regular traditional approach. I want to take a look at what potential role that precision medicine can be playing in the future of healthcare as it progresses. So in a previous episode, I really spoke on some of the fears that many people may have when it comes to the growth of AI, including within medicine. And one of the major points that I've actually noticed when it comes to precision medicine is its strong connection to technology and how technology could really potentially advance it. So one thing I think about is how you could really potentially plug in different factors such as symptoms that a patient could be dealing with into whether it's some type of application. And you could really potentially be looking at something that can help provide you with information that can help for a more nuanced decision. One of the things I even remember hearing about in conversation is this idea of even potentially being able to just punch in a couple of symptoms in some sort of app or chat or something like that and being able to receive some information that could help in terms of healthcare decision making and things like that based off of the nuances of your own specific condition or whatever symptoms you might be dealing with. I want to take a look at a paper that's in the CTS journal, or Clinical and Translational Science journal, and it's titled Precision Medicine, AI, and the Future of Personalized Healthcare. And there's a couple of things I really want to take from this. For instance, they mentioned that precision medicine methods identify phenotypes of patients with less common responses to treatment. So like I mentioned with the traditional model, we have this emphasis on what really helps the majority of patients and what treatments will help the majority of people. Precision medicine can really use stuff like genetics to really focus in and hone in on one patient's specific conditions and what treatments could maybe work for them. It really focuses a lot on looking at patients that may not respond to certain treatments the way that the majority would respond to them. So additionally, they mentioned that perhaps the most well-studied impact of precision medicine on healthcare today is genotype-guided treatment. So that really plays into genetics. Additionally, it's mentioned that the ability to make real-time recommendations hinges on developing machine learning algorithms that can predict which patients are likely to need a medication depending on which genomic information. So AI techniques have proven useful for efficient and high throughput genome interpretation. And I think that really just shows how AI and genetics can really just come together to potentially provide better, more personalized care for different patients. But now one thing I really want to connect this to is what impact this could potentially have on racial disparities in healthcare. Because I think especially when it comes to more personalized care, one of the things I can immediately think about is really just looking at different diverse populations and underserved communities and how more personalization in healthcare help or have some sort of impact when it comes to their care. And to go a bit deeper into this, I want to take a look at an article that was published on Harvard Medical School's website. It's titled Precision Medicine Health Equity. And it focuses on, can precision medicine reduce bias and disparities in healthcare? There are a couple of things that I was able to really conclude from this article. So for instance, precision medicine, I would say, could theoretically sort of help when it comes to identifying certain issues that different groups may be genetically predisposed to. For instance, I think about the example that's often given of African American patients being more likely to deal with conditions such as high blood pressure, high cholesterol, diabetes. However, one thing I do want to point our attention towards is something that was covered in a previous podcast, which is really just the fact that a lot of times people can be quick to sort of conflate genetic predisposition to certain diseases with social determinants that could actually be creating those conditions, to where it's not as simple as genetics being the sole factor as to why certain groups of individuals could be dealing with specific health conditions, but rather social determinants and things such as income, neighborhoods, and factors such as those could really be playing a role. And so one thing I ultimately concluded was that precision medicine could really help to deal with perhaps the genetic aspects of different issues. However, it would still really leave open the issue of environmental factors that really place certain populations at risk for different diseases. And part of this article really breaks that down well. They quote that, yet to date, genetics has had a disproportionately large profile in the public and professional understanding of disease risk. Scientists lack reliable ways to measure precisely how non-genetic factors can affect health and must develop better ways to measure the effects of the social, physical, and cultural environments on disease. And there's another paper that I want to take a look at that I think really highlights this even further. It's on Targeted Oncology's website, and it's titled, Despite Advances in Precision Medicine, Disparities Persist. And so they really go into detail about just the risk of potentially exacerbating health disparities with the growth of precision medicine and why that can be the case. They quote that, however, as with the introduction of new technologies into healthcare, there are concerns that genetic and genomic testing and services will not reach all segments of the population, both now and in the near future. And there remains a knowledge gap about potential healthcare disparities in precision health and genomic medicine approaches. And a major issue that I really want to get at that this paper really discusses well is really just a potential problem that different groups are really being better represented in research that informs precision medicine methods compared to other groups. They mentioned that outreach to minority communities, especially in the research field, has also been characterized by a long history of exploitation, abuse, and marginalization. The relatively lower participation rate of minority groups in health research is not simply a matter of distrust and unwillingness, but extends far beyond these superficial excuses. So what I really take away from this is that if minorities aren't really being well represented in the research that's helping inform precision medicine and push it further, then they're likely not going to receive those benefits and could maybe have worse inequalities. So ultimately, what I really just conclude from all this information is the fact that I think there are multiple pros that when it comes to precision medicine, as precision medicine in and of itself provides a way to really have more personalized care and look at nuances that will really help for physicians to really care for their specific patients effectively. However, I think we definitely have to have in mind the factors that can influence precision medicine to where it's not really able to be as effective as we would want it to be. And so I think a lot of that really just comes down to how it intertwines with health disparity, considering, as mentioned in this article, that minorities aren't necessarily as well represented in research. And so I think ultimately we should really just keep the values in mind that we want to really be able to have the best personalized and patient-centered care as possible, and really make sure to maintain a constant focus of trying to combat health disparities that exist. So with all that being said, that really wraps up this episode on precision medicine. I really wanted to be able to highlight the significance of it, how it's continuing to develop, and ultimately a lot of the different factors that come into play when it comes to precision medicine. And with that being said, that really wraps up this episode, and let's see what we talk about in the next one.